Dr. Sandra Lee built something few dermatologists ever imagine: a global media-driven medical brand rooted in something as ordinary as skin problems. What began as a modest dermatology practice in Southern California slowly evolved into a worldwide phenomenon, where millions of viewers tuned in to watch procedures that most people would consider too personal or uncomfortable to discuss. Patients came not only for treatment but for transformation, trusting her with insecurities they had carried for years. Over time, her calm presence and precise technique turned her into both a medical professional and a digital personality. Yet behind the viral videos and growing fame was a relentless workload, constant pressure, and a life that rarely slowed down. Every day demanded focus, stamina, and emotional resilience, an empire built on trust, but also on the quiet expectation that nothing could ever go wrong daily. A routine day under studio lights. At her clinic in Upland, the day began like countless others, with a tightly scheduled flow of patients, filming crews, and procedures designed to be both medical treatment and educational content. Cameras were already in place, capturing every careful movement as she worked with her usual precision. Patients arrived from different parts of the country, each hoping for relief from conditions that had affected their confidence for years. In the middle of this structured environment, she maintained her familiar composure, moving from consultation to procedure without hesitation. Then, almost without warning, her body began to feel different. A sudden wave of heat washed over her, accompanied by a strange sense of discomfort she could not immediately explain. Despite the shift, she continued working, assuming it was exhaustion or a minor physical reaction. The day carried on, but something subtle had already begun to change beneath the surface without immediate concern. Early signals the body cannot ignore. Later that evening, she left the clinic and went to her parents' home, expecting the discomfort to fade once she was away from work. Instead, the strange sensations became more noticeable. Her body felt unsettled, as if something inside was not functioning normally. A sharp shooting pain began in her leg, making simple movement uncomfortable. She tried to dismiss it as fatigue from a long day, but the feeling persisted. As she moved through the house, her balance felt slightly off, subtle enough to ignore, but present enough to cause concern. Each step required more effort than usual, and her confidence in her own coordination began to weaken. Still, she resisted the idea that anything serious was happening. In her mind, it could still be stress, dehydration, or exhaustion. But beneath those assumptions, something far more dangerous was beginning to develop silently and steadily, but she still pushed through, unaware. The night everything started to shift. As night fell, the discomfort she had been ignoring began to intensify, transforming from a vague unease into something far more alarming. Moving through her parents' house, she noticed that simple actions required more concentration than usual. When she attempted to descend the stairs, her body did not respond with its normal coordination. Each step felt uncertain, as though her legs were no longer fully under her control. The sensation was subtle at first, but it quickly grew harder to dismiss. Fear began to creep in, though she still tried to rationalize what was happening. Exhaustion, she told herself. Maybe dehydration. But the explanations no longer fit as neatly as before. That night, sleep never came. She lay awake, replaying the strange sensations and trying to convince herself they would disappear by morning. Instead, the uncertainty only deepened, marking the beginning of a far more serious realization in increasing silent panic. The moment realization turned into fear. The following morning, the situation escalated in a way she could no longer ignore. What had begun as subtle discomfort turned into alarming physical failure. As she moved around, she noticed her left hand behaving unpredictably, losing strength and coordination without warning. When she tried to grasp objects, her grip faltered, collapsing in a way that made her pause immediately. Soon after, she attempted to speak and realized her words were not forming correctly. Speech became slurred, disjointed, and unfamiliar, as if her own voice no longer belonged to her. In that instant, the fear she had been suppressing surged to the surface. She recognized the signs instantly, not as a patient, but as a physician. Everything pointed toward one terrifying possibility: a stroke. Yet even with that knowledge, her mind struggled to fully accept what was happening to her body. Her clinical knowledge collided with rising personal panic immediately. When knowledge fails the person who has it, despite recognizing the warning signs of a stroke, she found herself caught in a psychological struggle that many medical professionals experience when illness becomes personal. The rational part of her mind, understood exactly what was happening, yet another part resisted accepting it. This hesitation is not uncommon, especially when symptoms present in subtle or misleading ways. For many women, stroke symptoms do not always appear as dramatic or textbook cases. Instead, they can manifest as fatigue, sweating discomfort, or vague neurological changes that are easy to dismiss. In her case, years of experience made her aware of these variations, but awareness did not translate into immediate action. Instead, doubt created delay. She questioned whether it could be something less severe, something temporary. That internal conflict between knowledge and denial created a dangerous pause at a critical moment, but hesitation can turn critical when brain cells are already dying rapidly inside. The father who saw what others could not. As her condition worsened, she moved through the house in a state of growing concern, but it was her father who immediately recognized the seriousness of the situation. Also a physician, he understood the signs without hesitation or delay. While she was still trying to rationalize what she felt, he observed her symptoms with clinical clarity. There was no ambiguity in his assessment. He did not wait debate or second guess. He simply instructed her to go to the emergency room immediately. That decision, made in a matter of seconds, became a turning point in the entire sequence of events. In situations like this, time is not just important, it is critical. Every minute can determine how much of the brain can be saved. His insistence overrode her uncertainty, pushing her toward urgent medical care when hesitation could have had devastating consequences. His quick judgment altered the entire outcome, forever changed. Diagnosis and the reality of a brain under attack. At the hospital, medical imaging quickly confirmed what had been suspected. She was experiencing an ischemic stroke caused by a blood clot that had blocked oxygen flow to a portion of her brain. The diagnosis transformed uncertainty into a clear and urgent medical reality. In cases like this, the brain is extremely vulnerable, and every passing minute without treatment leads to irreversible damage. Brain cells begin to die rapidly when oxygen is cut off, and there is no way to restore them once they are lost. Doctors moved quickly, focusing on stabilizing her condition and minimizing further harm. The seriousness of the situation was unmistakable even for someone with her level of medical knowledge. What had begun as subtle symptoms had escalated into a life-altering neurological event. The phrase she would later repeat, that part of her brain had died, reflected the stark reality of the diagnosis. Time immediately mattered. What was lost and what remained. The consequences of the stroke extended far beyond the immediate medical emergency. For someone whose career depended on precision coordination and communication, even the slightest neurological change carried significant implications. Her hands, once steady enough for delicate procedures, now felt unfamiliar. Her voice, essential for both patients and audiences, no longer carried the same certainty. These changes created a deep sense of uncertainty about her future in medicine and media. The production schedule paused, filming stopped, and a growing television presence was suddenly placed on hold. What had once been a rapidly expanding empire now stood still, suspended by the reality of recovery. The emotional weight of this shift was profound, as she faced the possibility that the abilities she had built her life around might never fully return. In that silence, she was forced to confront what identity means when skill is taken away. Everything felt permanently uncertain now, from rejection to reinvention. Her journey into dermatology did not begin with certainty or ease. Long before fame or recognition, she faced a significant professional setback when she failed to match into her chosen specialty on her first attempt. This rejection forced her to reconsider her path in medicine and question whether she would ever enter the field she had long envisioned. Yet instead of stopping, she adapted. She pursued additional training, worked to strengthen her credentials, and eventually earned her place in dermatology. Her determination was deeply influenced by her family history. Her father, who had worked in a rural clinic in Malaysia with limited resources, had built a career through persistence and curiosity. He often relied on minimal tools and maximum observation to treat patients. Eventually, she returned to her roots, taking over her father's practice and continuing the work that had shaped their shared legacy. Resilience defined every step forward then, the rise of a viral medical phenomenon. In 2010, she took a step that would fundamentally transform her career and public identity by launching a YouTube channel dedicated to dermatology procedures. At first, the content was modest and largely unnoticed, reflecting a professional attempting to educate rather than entertain. However, everything changed with a single video featuring a blackhead extraction that unexpectedly went viral. The clip spread rapidly across the internet, drawing millions of viewers who were fascinated by the unusual combination of medical precision and visual curiosity. From that moment, her online presence expanded dramatically. The nickname she would later become known for began to take shape, turning her into a recognizable figure far beyond medical circles. As demand for content increased, so did the pressure to produce more, manage patients, and maintain a growing public image. Success arrived quickly, but it brought with it an intensity that left little room for rest or pause. Eventually, a life rebuilt after the silence, recovery was neither quick nor straightforward. For 2 months, she stepped away from operating, filming, and the demanding pace of her professional life. Even simple tasks felt unfamiliar, from walking steadily to maintaining the precision she once took for granted. Her left hand, essential to her work, did not immediately return to its previous strength, and that uncertainty lingered in the background of every day. Speaking and concentrating required more effort than before, reminding her constantly of what had changed. When she eventually returned to work, she did so with a heightened awareness of her own vulnerability. The environment that once felt routine now carried a new emotional weight. Yet over time, she adapted, slowly rebuilding confidence in her abilities. The experience reshaped her understanding of health success and resilience, leaving her with a perspective that extended far beyond medicine alone. She emerged changed, but still determined to continue forward.